we're not very informed consumers. And knowing that about our society, I mean, that's not right or wrong, that's an observation. Knowing that about our society concerns me greatly when now we're talking about marijuana, because we have never in our lifetime dealt with the possibility of an illegal substance moving to some form of legality. Ever. And so I would be concerned that that's a Pandora's box, that we're not really sure what's going to come out of that. And then once it's out, and there's no way to fix it because it's after the fact. When I hear people talking about legalization of marijuana for medical value, what I see is the model that the other states have taken. Because we don't call Marinol marijuana, legal marijuana. It's Marinol, it's a prescription medication. People view it as, here's my bag of marijuana that I'm now going to smoke, or I'm going to bake into brownies, or it's going to be, made into butter and I fry eggs with it. That's what people view that to be. That's the illicit use of marijuana that we're familiar with. So I'm not going to, there's a whole variety of substances available, botanicals, that some type of an extract could be beneficial combined with other things as a form of medication. What I'm fearful of is this idea that we legalize people to smoke marijuana because, like I said, it's opening a box. Not to mention, and we just talked about this at our office recently, if you look at how prescriptions are, they laugh because you'll say, well, I have a script for marijuana. No, you don't. A prescription is very specific. It says what I'm to take, the dosage that's required, the duration that I'm supposed to take it for, how regular I'm supposed to take that, very specific. How do you do that with marijuana? Because is every marijuana plant of the same strength? I can get OxyContin in specific milligrams. I can have an 80 milligram pill, I can have a 60 milligram pill, I can have a 40 milligram pill, and when the doctor is evaluating what I should take, he's going to take into consideration that I'm a female, that I'm this tall, that I weigh this much, that this is the level of pain I'm communicating, as well as a variety of other factors. How are you going to do that with marijuana? Because it's not regulated or manufactured in that way.
The point is that marijuana does help people, especially individuals who are suffering from irreversible neurodegenerative diseases that are just whether it's multiple sclerosis or Parkinson's disease or amyotrophic lateral sclerosis, Lou Gehrig's disease, or any of the other diseases of that nature, metastatic cancer, and so on and so forth. There's no question that some people, and I don't know what research will ultimately show, whether it's going to be 10 of 10, 7 of 10, or 4 of 10 do get some relief, but they definitely get some benefit. So therefore, you say, okay, is this a drug that we want to consider for people to use, prescribed by physicians and so on? What are the downsides and so on? Okay, so next thing you go to the downsides, and then you come to me and 100 other forensic pathologists who do autopsies on people all the time and say, when was the last marijuana death you signed out? I never signed out a death due to marijuana.
How many have you done?
18,000. And I've reviewed, supervised about 38,000 others.
What a lot of states are doing is sort of putting it out to the public to say, do you think that this should be legalized for medical reasons? And we trot out little kids with epilepsy and people sick with stage 4 cancer and say, how could we not help them? Ironically, if you look at the states that have long-term medical marijuana use, the people with their medical marijuana cards, those people that are getting trotted out to the legislators are not the people with those cards. The overwhelming number of people in those states with those cards are people that are using marijuana for the treatment of anxiety or back pain, chronic back pain. So it's almost, we've asked the public what they want and they get to vote on it, but we haven't told them the truth.
the argument that is made, and it's a legitimate one. Hey, you need these drugs. People suffer from pain. The people are hurt. People are injured. People have problems. They need. Yes, I agree. All right, but let's use the same argument now for marijuana. If marijuana helps people that are suffering, especially people that are in the process of dying, maybe a prolonged, painful scenario, then why would you want to deprive them? And the answer is there is no logical, rational explanation. It gets back to what I point out in the article. It is mythology.
And at this point, as far as marijuana is concerned, there isn't that research. But who wants to say no to sick kids? I don't. I'm a mom. Who wants to say no to people who have cancer? I don't. My grandmother died of cancer. So I think that it's really smart on their part, lobbying for things to happen, that to pull at our heartstrings, and that you bring out something that anybody would say on the surface, how could I say no to that, without giving the full picture. And to be honest, that's what we accuse tobacco companies of doing. That's what they still do. Look at an ad. Here's all these people with nice white teeth and young-looking skin. And if you're a long-term smoker, do you look like that? No. But we have to know that that's not telling the truth. And unfortunately, we're not applying that critical eye as it comes to this argument with marijuana use.